we talk about regenerative treatments like PRP or prolotherapy or stem cell stuff. Again, it's just tapping into the body's ability to heal itself, which is one of the core tenets of osteopathic medicine.
Hello and welcome back to The Mover. My name is Catherine Reber and I'm a doctor of physical therapy working out of Kinetic in Westchester, Pennsylvania. And today I am joined by a family medicine and sports medicine physician, Dr. Brandon Eck, who is a recent addition to the Penta Health primary care practice located in Downingtown, Pennsylvania. And Dr. Eck is also a former team physician for Virginia Tech, Radford University, Elizabethtown, and even the U.S. ski team, which is pretty cool. And we'll get into that in just a little bit. But Dr. Eck, thank you so much for joining us this morning.
It's a pleasure to be here.
This is awesome. So we were just talking about your little ones. You have 2 children, if I'm correct?
I have 2 children, yes.
Excellent. And you said you're sleeping okay so far?
For the most part, yeah. We're doing pretty well.
Awesome. That's amazing. So give me the scoop in terms of what life looked like pre-kids, pre-med school, all that stuff.
Well, before kids wasn't that long ago, but then again, it was also during COVID. So tried to get up early every day, exercise, get ready for the day, get to the office, see patients, do what I needed to do there. And then in the evening, go home, make dinner, maybe catch up on some work and some other things, relax with my wife, and then we would go to bed. Now that's changed completely.
I was going to say, me too. It's so different. It's really crazy.
It's wild.
Where did you grow up?
I grew up in State College, Pennsylvania.
Okay. So are you a big Penn State fan?
I wouldn't exactly say big, but big enough that I still follow the news and follow the sports teams. It's hard to keep up with all the changes.
Totally. Did you go to a lot of the sports games, like the football games and stuff?
I did. It's actually funny because my father and my mom both worked at Penn State for many years. And my dad was in the athletic department. So for us, we spent a lot of time after school or in the evenings or in the weekends at sporting events or in the training room with my father.
Mm-hmm. You were pretty athletically driven, if I'm not mistaken. So do you feel like that's kind of where everything began, is just kind of being around that type of culture at Penn State?
I would think so.
Yeah.
Yeah. I mean, subconsciously, again, and as a child, you don't necessarily realize, but you can be a product of your environment. And so if you're spending a lot of time in those places, you're probably going to pick up on a lot of little cues and things like that you may not realize until many years later.
Mm-hmm. What sports did you play growing up?
Probably a better answer would be, or question would be, what sports didn't I play growing up? So we were exposed to just everything: soccer, baseball, football, basketball. I'm one of 3 boys, so we also had to be active because otherwise we would just tear apart the house.
Of course. What's your lineup? Are you the youngest, oldest, middle?
I'm actually the oldest. So I have 2 younger brothers. We're not all far apart in age though, so there's only 3 years separating all of us.
Yep.
So we still get along pretty well.
Excellent.
Nowadays.
Where did you go to college?
I went to Villanova University.
Go Cats.
Go Cats.
And did you play sports there?
I ran track there.
And what was your event?
Mostly the 800 meters.
Okay.
Sometimes I would go into the 400. I ran a 1500 a couple times.
Okay.
Towards the end.
So when you were at Villanova, were you pre-med that whole time?
I was.
Okay.
Yes.
How did you juggle that? Because I think being a college athlete and especially being in a very demanding field or subject like that can be really tough. So how did you juggle it all?
The nice things about more of an individual sport like track and field gives you more flexibility. So, I was able to handle getting my classes done, training, when I could fit it in. And again, we would work around the practice times to be with as many of my teammates as possible. Again, being a sport that, again, it doesn't require you to necessarily be at practice every day, working on team dynamics and working on other specific things of the sport. It was relatively easy to work around.
Are you still a big runner today?
I wish I had more time to run, but I like to think that I will be able to run more, but running when I can.
Gotcha. We just got one of those jogging strollers for my 1-year-old. And the other day I said, let me just go out there and try a jog. First time. So I went to a park around this area and I'm jogging, and I thought I was sprinting. And then I finally am like getting up to somebody, like there was somebody else in the park and it was a guy walking. He was just kind of like speed walking. And for about 3 minutes, I was jogging at the exact same pace that this guy was walking. And I was like, I gotta move it a little bit. But you know what? At first, in the moment, I was so disappointed. I was like, oh man, like I really lost my stamina here. And my power is just not what it was. And I'm also pushing a 1-year-old, but I was also proud of myself. I'm like, you know what? At least I'm getting out here,
Absolutely.
Nice. Do you guys have one of those jogging strollers?
I do, and I thought pushing one wasn't too bad, and then I added a second one to the
Oh,
stroller. It's a lot to push two children and one of those things around, especially up a hill.
absolute. Oh, the hill, forget about it. I was barely crawling, it was not good.
Absolutely. And the other problem is they don't ever seem to get lighter.
They absolutely not. It's crazy. They
I don't
turn
know what
well,
it
but
is,
they don't really get lighter at all.
but then you also have to remember too that they need something to do. So then you have to bring in toys and snacks and water, and
Hmm.
next thing you know, the whole thing is full of stuff.
Nothing is easy. We need to have a full class on how to teach parents on how to take some time, at least in part of the day or part of the week, to be able to move a little bit. And it looks so different. I was somebody that always had a very regimented workout plan for my week, and I would get very upset if I didn't get it done. And it's so funny, like the way that you really have to fight that. That rigor, and
Hmm.
my mind has shifted to just, again, find ways, like put some dumbbells in the house just to be able to get some stuff done throughout the week, because it is hard.
Yeah, absolutely. As we're extremely busy with everything that we've got going on, whether it's work or home life, again, figuring out how to just integrate your kids into what you like to do, and if working out and exercise is important, then again, that's really something that's going to be valuable both for you and for them.
Totally.
But it can create some challenges as you try to figure out how to best do that.
Totally. Are you in the clinic every day?
Right now, just 4 days a week.
Okay, gotcha. Okay,
So it's nice that I'm able to, have one day where I can be able to be home with my kids and entertaining them and exploring the world with them,
gotcha.
but allowing my wife to work or get other things done.
Okay. So where did you end up going to school after Villanova?
I went to Philadelphia College of Osteopathic Medicine,
Okay.
also in Philadelphia.
Where is that located in Philly?
It's just outside downtown on City Line Avenue.
Okay. And then did you do your residency there as well?
I did, but the residency clinic is actually located out on the edge of Norristown. So a
Gotcha.
little bit different area, but I was able to stay or live near the city still.
Okay.
So I got some social components of life
Yeah.
during residency.
Now, while you were there, did you always know that your career would end up into more of like a sports medicine focus at some point, or did you primarily think just family medicine?
No, well, I should say yes. That was my intention, throughout the process of medical school. I felt more reassured that was the goal that I wanted, and I continued to explore some other fields, but at the same time, it helped reinforce that was my end goal. Throughout this whole process, again, I think all the other experiences I had just, again, continued to reinforce that process that allowed me to get to where I am today.
Mm-hmm. Can you talk a little bit about the difference between like the osteopathy philosophy versus more like the allopathic approach, kind of like DO versus MD?
Yeah, I mean, I can only speak from my experience with in terms of going down the path of what the osteopathic philosophy is and how that incorporated into my treatment style, and also how that relates to, I guess you could say, a more traditional form of medicine. But I
Mm-hmm.
think that osteopaths were a little bit more willing to consider alternative treatments and explore alternative options for patients, not just in your specialty fields where treatment is really standardized. But again, I think that integrating a lot of different components of overall health into how patients are being treated has been really valuable for us in the field. But it also makes us unique in that regard. And I think that to the extent that we can explore that with patients being more personable, having better listening skills, and being able to connect with patients, whether it's through just communication or even by touch,
Mm-hmm.
that can be really valuable for that patient-physician relationship.
So when you're saying like other treatment options, are you saying more, just things other than like a medicinal approach? Is it more conservative options that you tend to consider when you're treating somebody?
Yeah, I think so. Again, I think, we as DOs, we are taught about, osteopathic manipulation, which is a form of manual treatment. We're more, I think, more open to, exploring, again, non-medical or non-traditional treatment options. Now, again, I'm not saying we're going off into the weeds and doing a lot of non-researched treatments or using things that just aren't medically or literature supported. Again, I'm just saying that, again, I think that there's a lot more approaches to treating a patient other than just what is considered a standard.
Gotcha. Do you feel like on a day-to-day basis, are you working with primarily other DOs, or is it in the mental health practice or even other practices that you worked at? Are you working with primarily DOs or other MDs or kind of the whole range of people?
I still feel like the DOs are still kind of in the minority
Mhm.
in some practices. I think there's a good mix in my current office, but in my previous experience, there were several MDs in every office I worked in.
Gotcha. When did you start at Penta Health?
I actually just started this past December.
Amazing. And how's it going so far?
I think it's going pretty well.
You like it?
I really like it. I like the patients. I like my colleagues and the staff, and it's been a really welcoming practice.
And what did you do before Penta Health?
I spent the last 7, 8 years working in the orthopedic world. So lots of sports medicine experience, working with athletes and active individuals, doing a lot of orthopedic injury
Mm-hmm.
management.
Okay. I always want to ask somebody this. So what if you have somebody that comes in, like let's say a really high level athlete versus let's say the weekend warrior, right? Maybe like a 45-year-old person that just works out on the weekends for people that don't know that term. Let's say they have the same injury. How does the conversation differ for those two types of clients? I mean, are you going through the exact same exam types or tests that you're putting them through? Is the treatment approach similar for something like that?
I think it really depends on obviously who we're treating. Is it an industrial worker who can't really miss work? Is it a mom who is taking care of one kid or 3 kids or 5 kids? Again, is it a high level athlete? I think it becomes an individualized treatment for that person. And it also depends on what they've done before, what their current time frame of recovery looks like. And so for a high level athlete, time of training is one of the most important factors. And so I think that treatment tends to be a little bit more aggressive.
Mm-hmm.
But at the same time, I still recommend incorporating those other treatments, the physical therapy, maybe it's massage, maybe it is medicine on top of, any procedure that we need to do, or, any focus of what the best treatment for that individual is.
Sure. Do you work a lot with like physical therapists or other just like rehabilitation specialists?
Yeah,
Mm-hmm.
absolutely. I think the value of physical therapy is undervalued to some extent, and I think a lot of people are looking for a quick fix. But then when they're working with a specialist in physical therapy, we're able to get patients to where they need to be cohesively as a team and achieve relief of whatever ailment we're treating. And I think that having a team of therapists that you work with, or network, I guess you could say, is really valuable for patient care.
Totally. I think I have such a soft spot for DOs because, of course, as PTs, we really value the just the foundation of like mobility and movement, and that it's just so important for someone to be able to go about their day to day. And I love how that's one of the big concepts that you guys touch upon too. Can you talk a little bit more about like kind of the osteopathic like manipulative treatments that you typically do, like the more hands-on approach? What does that look like for somebody who's never seen a DO? Because it is a little bit different than going to an MD.
Each osteopath that does do manual manipulation is going to have a little bit of a different treatment approach.
Mm-hmm.
Again, their focus, their style, it's all very individualized to how that practitioner learned how to treat a patient. And
Mm-hmm.
so for me, I want to be able to look at a patient the way that they're walking in the room, moving, getting up from the chair, sitting on the exam table. I then would move towards a hands-on treatment where I'm actually physically touching the patient and feeling their movement, feeling where there's tightness and restrictions in motion. And then I'll start with some easier treatments that are, again, basically the patient just lays there and I'm using pressure and allowing the tissues to do their own relaxation. And then I'll move into more manipulative treatments if I feel that the patient would tolerate something a little bit more aggressive that would actually physically realign the spine or a joint when needed.
Mm-hmm. I think the power of touch is very underrated at some points. I'll never forget, I had a couple of mentors that always discuss, like, make sure, at least for the first session or the first few sessions, like, you have to be hands on with somebody because you don't really know, of course, someone can describe how they're feeling, but of course, everyone has different levels of perception of their pain, right?
Mm-hmm.
You'd have somebody or two different people that have the same exact injury, but feels totally different for whatever reason, right?
Mm-hmm.
But a lot of times it can be their pain tolerance, their pain levels. So being able to actually like touch someone, feel the tissue, see how they're responding to that touch is so important. And even from a PT perspective, we do a lot of like test retests, right, within a session. So,
Mhm.
like, let's just kind of see where you're starting off now. Let's try these different movements, manipulations, or even exercises. And then let's see how you're feeling towards the end of the session and see if that even made a difference, right?
Mhm.
And see if we were able to get some response from the tissues too. So I think it's really important. I love what you were saying about, that the first, when they're walking in, you're kind of looking at how they're getting onto the table, because we take that same approach. Work in Westchester now, but I used to work in our clinic in Collegeville. It's a beautiful clinic. It's got floor to ceiling windows. And, I would always say to people, like, our exam starts when you walk out of your car because I can see you. I'm not trying to be creepy, but, I am looking like, how are they walking in today? Are they limping? Are they, kind of like holding their back as they're getting out of their car? And again, it's not to be creepy. It's just that's part of our examination, right? I want to see how you're walking into this place before we even talk about how you're feeling that day.
Building on that, I want to say that I think that your listening and observation skills are really valuable as a clinician. Again, the patient's going to tell you whether it's physical movement or it's actually a verbal communication. And a lot of times we say, oh, my shoulder hurts, but it's not necessarily just your shoulder. It also kind of works on your core and the way that your hips are moving and the way that you're walking in and out of the office, that can give us the clues that we need to figure out exactly what is the comprehensive nature of your ailment.
Totally. And I think also from the PT perspective, like you were saying too, it's a lot of getting to the root cause, right? Like, it's a big part of what we have to do as clinicians for PTs is educate people that this is not going to be a quick fix, right? We
Mm-hmm.
kind of need to take the time to actually make changes, physical changes to your body. And that, just to make small cellular changes like that, or to the muscle, like that takes 4 to 6 weeks, right?
Mm-hmm.
To just at least start to see some things. And I always preface that, of course, to give people a little bit of an expectation of like, what are we looking at here time wise? And it's one of those things, you're not going to be cured in 4 to 6 weeks, most likely.
Mm-hmm.
But that's when you may start to notice things. Like, you may say, like, okay, I can get out of bed a little bit easier, or maybe able to walk up the stairs a little bit easier than I was before. Things like that. But again, we live in a society where everybody wants the quick changes to occur. But I do appreciate, the people that are able to listen to us and say, okay, I do want to just take the time to get this done. If it takes
Mm-hmm.
a couple months, whatever it needs to be done.
The thing patients don't realize is that as a high level athlete or a professional athlete, like, you're paid to perform, and so you're able to mobilize these resources, like seeing a physical therapist every day or seeing a massage therapist several times a week, when us normal patients may not be utilizing those services as much, or have those opportunities to do so. But again, without a quick fix, utilizing those treatments and utilizing those hands-on skills, soft tissue modalities, and things like that a physical therapist can provide, and patients can utilize that every week for 4 to 6 weeks, they're going to get to where they need to be. Yes, it's going to take a little bit longer, but they're still going to get there. And I think that there's a misconception there that, oh, how did that athlete get back on the field so quickly? Well, it's because they did the rehab and they did their treatments literally every day for 3 or 4 weeks,
Mm-hmm.
6 weeks, however long it takes.
Mm-hmm. I'm a pelvic floor specialist as well. And so I do internal treatments. And I think that's one of the coolest things too. Even I didn't go to school thinking that I was going to be a pelvic floor
Mm-hmm.
therapist. It's just something that kind of fell into my lap. But I was fascinated by the changes that were able to be made so easily, right? And just by doing some of the internal, like, soft tissue release for somebody, like, in particular, that may have like pelvic pain, or of course any other symptoms. But I think it fascinates patients too. They're like, I didn't even know I had muscles in there. But it is pretty cool to be able to provide that direct relief, but from a soft tissue standpoint, right? It's really not, I always tell them it's not rocket science. Like, I'm really just going in there and pressing on some muscles, seeing if we can get a little bit of an in-session change, and then seeing how that carries them through the week too. But I really appreciate, again, that ability to be able to, touch and heal somebody in that way.
Absolutely. I think the feedback that you can get, whether it's instantaneous or maybe it takes a little bit longer, I think can be really surprising to patients, but also as the clinician, you can get that feedback that really helps reinforce, oh, that was, what I should be doing, or, oh, maybe I needed to go in a different approach to get a different response, depending on whether the patient did positively respond and felt better, or it was a negative response and they felt different.
Mm-hmm. So, talk to me a little bit about how these opportunities presented for being the team physician for some of these schools.
Well, as a fellow, in
Hmm.
my training. Again, I think that's just part of the program.
Hmm.
So it was, the opportunity was presented when I was accepted into that program. So Virginia Tech,
Okay.
Radford University, and some other opportunities.
Where'd you do your fellowship?
That's where I did it. Worked at Virginia Tech
Oh, at Virginia Tech. Nice.
for 1 year, and they have these relationships with the various clinicians, and then in the community where we were able to work with again the athletes in the athletic department at Virginia Tech, Radford University, which is just down the road, some local high schools,
Hmm.
and even a minor league baseball team.
So when you were at these schools, were you seeing all of their athletes?
Pretty much, yeah.
Wow,
Hmm.
amazing. Who was the most common athlete that was coming in? A lot of football players,
During
baseball
the football season, it
players.
was mostly football, a lot of soccer athletes too, and then in the winter, basketball, wrestlers, not as much the individual sports, so not like as much track and field, not as much swimming. And then in the spring, a little bit of baseball, some softball, lacrosse. In Virginia Tech, they have a really nice program, and I don't know what it is like now. I'm assuming it's still kind of very similar, but it's basically a primary care office for all the athletes. And so, like if they had anything, a rash, runny nose,
Hmm.
back pain, they would come in and they had a full clinic that we would be staffing
Hmm.
for the athletes to come in, whatever their needs were. And it was great because then the athletes didn't typically have to go to student health or to go off campus.
Hmm.
But clearly, when they did need something that we didn't have there on site, then we would refer them to those resources.
Did you really enjoy being in that type of setting? Like, is that something that you could see in your later career doing?
I mean, possibly. I think that there are some of the bigger Division I schools in college sports that do allow or have the setup to be able to offer something like that. But smaller schools, Division III schools, they don't have the resources to be able to offer that kind of stuff
Hmm.
because it is kind of expensive to be able to offer that. And but in some situations, it's just having a physician that would even be willing to come out to the school to help give their insight and their expertise
Hmm.
to help managing these athletes' injuries.
Hmm.
A lot of it comes down to time, too. Again, without those resources, it's going to be difficult for a lot of these athletes to get the personalized care that they probably deserve and need to get back on the field. Whereas that's different at a higher level.
Hmm. Was there a case that still sticks out to you today from when you were a fellow? Maybe just a bad injury, a bad concussion, one of the athletes that you treated, something that, kind of will stick with you forever?
I think there were several challenging cases that there was nothing that was catastrophic, which was great. A lot of it was bread and butter type injuries. But at the same time, there were certainly some unique ones
Sure.
that required, either referring out or again, they required multimodal treatment that then, ultimately resulted either in the athlete not participating in the future or was able to get them back on the field,
Sure.
pretty quickly.
Sure.
But I feel like somebody as early in my career as I was at that point, I was just, again, I was just taking it all in.
Yeah, of course. So tell me a little bit about the ski team. How did this happen, the US ski team?
Well, my one of the program director, my mentor, Gunnar Brolinson, he was involved with the U.S. ski team for many years. At that point in time, I think he was one of a very limited number of physicians that had volunteered for more than, or was offered a volunteer position on more than one Olympic medical staff team. But he had been involved for many years, and through his guidance and his support, I was able to get into the volunteer medical pool.
That is so
And
cool.
it's a pretty cool organization. Again, it's all volunteers. I think it's pretty cool that the head physician was featured in some commercials on the most recent Winter Olympics,
Wow.
which was pretty cool.
Did you
Uh,
work with him?
I went to a couple conferences and he was certainly there, and I've definitely had some conversations with him,
Yeah,
but I never got to directly work with him.
sure. So what was your role like in the volunteer pool?
The volunteer pool is basically just a group of physicians that are willing to offer their services, traveling with teams to various countries. I got in right around the time of COVID, so there weren't as many of events,
Hmm.
but I was able to go to Sweden with one of the junior teams and
No
get some
way.
experience being in the field,
That is
which was
so
really cool.
cool. While you were there, again, were there any injuries that you had to take care of like on site on that at that time?
There were a couple falls that required me to ski down to the athlete and evaluate them, but nothing crazy. It was there during a training block, so it wasn't like they were competing and putting their bodies through their competitive runs. Whereas training was a little bit more just working on specific techniques or
Hmm.
working on speed or whatever it
Hmm.
was. So they weren't going full tilt.
Hmm.
But you never know when an injury can happen.
Sure. You answered my next question, which was, do you ski? And because I was assuming you would have to be able to ski down to assist somebody.
Yeah, that's one of the primary requirements
I was gonna
for the
say,
position.
unless you were on a snowmobile or something, I don't know how that would occur.
Yeah, I think even traversing a snowmobile on some of these courses is
So
is
true.
is quite radical.
So true. Did you ever get a chance? Did they let you ski through any of their courses or anything like that?
The the course in Sweden was like when I was there was literally just a sheet of ice, and I can't imagine skiing mogul. I was with the moguls team, so I can't imagine skiing moguls at the high speed that they do, with the control that they're able to do. Go off the jumps, do the flips and turns and all that stuff, land, and then continue to go, at a very high speed.
Somebody was injured, let's say at like the middle of the moguls. Would you have to ski through the moguls to get there?
Typically, you wouldn't have to.
Is there like something on the
No,
side?
there's usually people on the sides, but in some of these venues, I'm sure that you're going to ski down to some extent.
Yeah.
So, you're going to go down on the side of the course.
I'm just imagining a camera following you, like, okay, next step, Dr. Eck coming down, going through the moguls.
That
That's
would be
amazing.
quite the sight, right?
How long have you been skiing for?
I grew up skiing, so I've been skiing for many years.
Where do you ski?
Wherever I can. Unfortunately, again, children take up your time, so it's hard to have that right now. But that'll be something in the future. I'm hoping that I can
Totally.
involve them in.
Are you a northeast guy or west? Out west.
I like both. I mean,
Yeah.
they're both different,
Mhm.
but with time being valuable, it's hard to really go west when you have to fly and
Totally.
all the travel considerations versus driving to the northeast
Totally.
is really nice. But then again, we have some okay snow in the Poconos.
Yeah.
Um,
I'm a big skier too.
year
That's why I'm
year
asking.
dependent.
We have my family has a place up in Vermont, so we go up all the time. But
Cool.
I mean, out west is game changer for sure.
Yeah.
We went to Park City a few years ago, and it was when they had like record snow. And I'll never forget, my husband and I were on a chairlift going up, and it was just the two of us and then this one guy next to us. And as we were going up, it was this beautiful blanket of snow, but there were all these like little bushes. And I was kind of like, that looks weird. Like maybe they planted some new trees. And we were kind of just talking amongst ourselves. And the guy next to us starts laughing. He goes, "Oh, those aren't bushes. Those are the tops of the trees that you're seeing. Like that's how much snow they had." And that it was just the craziest amount of, I've never seen snow like that. It was obviously amazing.
Mhm.
But then of course this year they got nothing. So I'm glad we didn't plan any trips, to go out there.
For sure.
But it was really cool.
I've skied snowbird in waist high snow. I've skied
Yeah.
sheets of ice in the Northeast.
Yeah.
But I've also skied fresh powder in the Northeast too. So
Oh yeah.
I'm a big fan of Sugarbush. I really like
Yeah.
what their resort offers.
Yeah.
And I think the variety of terrain is really great.
Yeah.
But again, I think I'll have a new perspective here when I get my kids involved, 'cause
Totally.
that changes everything.
When do you
quite
think you're going to
drastically.
start them? How old?
I think in the next 1 or 2 years, I'm
Yeah.
hopeful that we can do it.
Yeah.
A 2-year-old, 2 or 3-year-old, it feels daunting to get on the slopes, but even just getting them to experience sliding
Absolutely.
is really valuable.
And frankly, they're so close to the ground. They're like, if they fall, and first of all, they're made of rubber, but if they fall, they're so close to the
Just put them
ground.
in an extra jacket. That'll be an extra cushion, right?
Absolutely. It's like, those commercials, I think it's the Progressive commercials. It may not be Progressive, where they have the whole car wrapped in bubble wrap.
Mhm.
I'm like, that's kind of what we need just for
Yeah.
the little kids.
There's a local ski mountain that's basically a great place to learn. I think Spring Mountain.
Yeah, right by Phoenixville, right?
hmm
Yeah.
Yeah.
Have you been there?
I have not been there to ski yet, but I plan to do so here in the future.
Have you ever taken any bad falls yourself?
Yeah, I've had some pretty gnarly falls.
Yard sales?
I will admit, yes, may have been some yard sales.
Who hasn't?
That's part of learning,
Absolutely.
right?
Absolutely.
It's like falling off your bike. You got to get back up and just again keep trying.
Absolutely.
You'll learn.
We went skiing. I had actually a bunch of friends from PT school with me up in Vermont. We were skiing and I had turned around to make sure that they were still behind me, and I hit an ice patch and just ate it in the snow. And I've had a couple concussions, but that was one of those where I got up and I literally was seeing black and stars, and I was trying to really play it off like it was, because we were on our first run. They were there for the weekend. It was the first run. And I stood up and I was like, I feel like I'm going to throw up. I don't feel good at all. And I don't know, we were on the other side of the mountain, like not even close to the base. So they pretty much, helped me get back. We probably should have called the one of the emergency guys to come, but that was pretty tough. Have you, so I do understand that you do some work with concussion management. Talk a little bit about that in terms of when your like love for that type of thing occurred.
I think that that's one of the more challenging injuries to treat for individuals, particularly people that are really active,
Mm-hmm.
and especially adults that have kids or again are working. But sport-related concussions are still an evolving treatment.
Mm-hmm.
I think where we stand in terms of literature, in terms of research, and experience treating. The earlier we're able to identify that an athlete or an individual has a concussion, the faster we're able to get them into physical therapy to help with their symptoms, and then
Mm-hmm.
also allow their brain to rest. It's one thing to put a brace on a knee or a brace on an ankle. You can't exactly do that with your head. So
Mm-hmm.
working with a patient to figure out what would help them minimize their symptoms to allow their brain to rest is really, really important. And that's to some extent where the art of medicine comes in, and using your skills as a provider to determine what is their level of difficulty with certain movements, certain tasks, and then using a combination of treatments, whether that's manipulation, just physical therapy to work on the vestibular system. Do we need to modify the eyes in terms of how they're being stressed, headache management on top of all of this? Or is it just musculoskeletal, tight muscles around the neck, upper back? It's a really comprehensive treatment that takes sometimes a lot of digging and to the patient to figure out exactly what's going on. And then you might uncover all the physical ailments that are plaguing the patient, but then you realize there's a whole nother segment where we're dealing with psychological components, anxiety, a little bit of depression symptoms. And again, it can take quite some time. But again, the faster you get in to the office to be evaluated, the faster you're going to be able to get better and
Mm-hmm.
back to what you need to do.
Yeah. And like you said, I think the symptom presentation can be so variable and so different for everybody. So it's really important to make sure, just as clinicians too, to go through all those different checkpoints and making sure that you're checking them out as a whole,
Mm-hmm.
not just like the classic symptoms. Do you feel like the management for concussion protocols has that changed a lot from what, people are doing today for concussions versus 15, 20 years ago? Like, do you think it
Mm-hmm.
has changed just based on research that has come out?
Yeah, I think 15, 20 years ago, we didn't have tools to help us, diagnose concussions. And so for people, clinicians, physicians that don't have a lot of experience, they might rely more on these apps on an iPad or the computer programs that the testing that we put athletes through to get like a baseline and then compare before and after. Or again, for patients or for clinicians that have a lot of experience, it's just based on your examining being comprehensive in the evaluation.
Mm-hmm.
I personally feel like I have enough experience now that I don't necessarily need a computer program, or I
Mm-hmm.
don't need necessarily an iPad to diagnose an athlete with a concussion
Mm-hmm.
because of my skill level at this point. But they are really nice to have when they are available. There are schools that still will have an iPad as a opportunity to have a baseline for many athletes, and then I can have that information that they can have as a baseline and then compare to after their injury. It's sometimes helpful, to monitor progress. And, for some athletes, they can be completely fine in 95% of the scenarios that they're presented daily, but there are certain scenarios in their sport or in their life that they're still struggling with. And then that's really where high level experience, but also a special toolbox is really important
Mm-hmm.
because recreating some of these environments that athletes are exposed to are extremely difficult to recreate at times.
When you talk about like the different like computer apps and like different diagnostic tools, what kind of is it basically like a questionnaire, or is it a screen that's showing different like lights or something like that? What is that? What do those tools look like?
I haven't gone through them personally in quite a while,
Mm-hmm.
but a lot of them measure reaction time. They remember short-term memory. They assess recall. They assess your ability to be accurate with, like, say, clicking a mouse or clicking on the iPad with the different circles, pattern recognition, and then again asking you some words at the beginning, and then having you repeat those words back to you at the end. To assess recall, there's a certain degree of bias that can be present in those, which could be a problem. Again,
Mm-hmm.
especially if an athlete really throws the baseline,
Mm-hmm.
so they don't really have a great comparison to from before your injury or after if they didn't really give a good effort
Mm-hmm.
during that baseline. But there are other iPads programs now or apps that will measure just balance, so your ability just to stand still
Mm-hmm.
on both feet or on one foot. They'll look at your eyes and look for a subconscious eye movement.
Mm-hmm.
Again, you're having a lot of rapid eye movements that you may not even realize are occurring, and that pattern will
Sure.
change from normal baseline to, again, after an injury, specifically if they're having a lot of symptoms. And I've even referred patients for like a slow motion camera evaluation or infrared evaluation, where again the clinician or a clinician is looking specifically at those little micro movements we don't otherwise see,
Right.
and that can be really helpful to diagnose a component of a patient's problem.
Did you gain most of your knowledge in concussion management when you were doing your fellowship?
I think there's a good base, but a lot of it's been just collected over time. The more you see these types of injuries, the more experience you're gaining, and then the
Mm-hmm.
more comfort you have evaluating and talking to patients about these individual components of a concussion, and
Mm-hmm.
then having a good network to be able to get the patients into the various clinicians that then
Mm-hmm.
require their services.
Mm-hmm. And just in like the primary practice world, do you feel like it's mostly young athletes that are coming in with something like this, or are you getting the people that are 40 plus?
I think it's more the general population that are stuck with without getting a lot of correct treatment, or it's going underdiagnosed. Unfortunately, I think it really depends on the practice, where and some of the marketing to an extent,
Right.
where the athletes go. Unfortunately, I feel like a lot of family medicine physicians aren't as well trained
Mm-hmm.
in the nuances of concussion. So a lot of times you'll see get an athlete gets seen in urgent care or an office,
Mm-hmm.
and they kind of have they'll be better in 2 to 3 weeks, and they can go back then. But um, 2 to 3 weeks goes by, and the athlete is either they were better on day 5 and they
Right.
wasted 9 days, or they're still very symptomatic as soon as they step on the field.
Right. And you're just prolonging the recovery even further.
Exactly.
Mm-hmm.
And so again, that's why it's really valuable for you to get in with somebody that has experience treating these injuries, as well as educating clinicians. And I think that there are a lot more clinicians that are interested in treating concussions, appropriately, and or getting better training, throughout their residency or fellowships, whatever
Right.
it is. Just having those connections is really important in the community to be able to get the local high school athletes in, get the local college athletes in, and service them in a way that's productive for their recovery.
Right. And if for any parent, if your child has a concussion or you suspect that they have a concussion, I mean, the PCP is going to be the first person that they're seeing most likely. Do you have any advice for somebody who's calling into a PCP's office? Like, do you suggest they ask, can I have my son or my daughter see somebody who specializes in concussions or sees concussions a lot? Or, would you just say, give them a call and hopefully it goes okay
I
in
mean, I
that
think the
office
most
visit?
important thing is they're at least getting evaluated by somebody.
Right.
And, it would be helpful if that person has some experience treating the athletes, or, at least some interest or some clinical knowledge about what a concussion is, how it's treated, how does it even evaluated to begin with, and then, go from there. And make sure there's no like red flag symptoms.
Right.
The literature doesn't really support imaging as a first line evaluator of a concussion. There's not even a great blood test or anything like that, and so modern medicine, with all of its bells and whistles, it's still relying on the physical exam to figure out to some degree what the extent of the injury is.
Mm-hmm.
And so again, that's really where again having an experienced provider really makes a big difference.
Do you think that one day there will be some type of like brain image that can show that there was a concussion, or like even like if there was like a level of degree of the severity? Is that where the research is heading for something like this?
It's definitely evolving, and I think that that will hopefully be something that we can utilize. I mean, we can do blood tests on body inflammation, but
Right.
Utilizing brain information or brain inflammation, I'm sorry, would be again, I don't know how far away we are from that, but having a marker that we can identify that would be really potentially helpful. That's minimally invasive would be really a great thing to have.
Mm-hmm.
But at the same time, again, I think that with the complicated nature of these injuries, again, having experience is really the most valuable
Mm-hmm.
tool that physician can offer.
Sure. What's your take on how much is too much in terms of concussions? Because especially with kids starting sports and especially like really high level sports early on, of course, more at risk for concussions, especially contact sports. But have you ever had to have a conversation with an athlete or their family in terms of, listen, you've had 4 concussions now and you're only 18 years old or something like that? May want to look at something else going forward, or how do you go about that? Or what's your take on that?
It's not an easy conversation to have with an athlete or even parents to that extent, but it really revolves around framing the injury, the types of injuries they're experiencing, and then more importantly the symptoms, trying to get them to understand that what are the long-term implications of these repetitive injuries, focus a little bit more on the current state of dysfunction that they're experiencing and the symptoms that they're being derived from. What are they missing, and again, how does that look if they're having ongoing issues, at 16 or at 20 or at 30? What is it going to look like, another 10 or 15 years down the road?
Mm-hmm.
And then what is the value of them continuing whatever sport they're involved in? And then figuring out, hey, are there other outlets that they might be able to pursue that still give them the gratification that they're getting from their main endeavor? But it is really difficult, particularly when a patient is symptomatic. And so, the first thing is, hey, look, I'm going to get you better. We're going to get rid of your symptoms. We're going to get you, to a point where we can have a real conversation about this, whether it's 4 weeks out, is it 10, 12 weeks out? I've had a few athletes that have come back months after I treated them for their concussion, and then they're still reporting symptoms. Or there's an anxiety component that I end up addressing, with that athlete. And then, or maybe in some situations, it's been the athlete they've self-removed them from whatever they were participating in because things changed, or they didn't feel right, or again, their injury they didn't feel comfortable competing anymore in that sport.
I noticed that some sports, especially like in high schools and stuff, they've started doing more like prevention programs of just learning how to take a hit or to hit, right? To prevent, direct contact in that manner. And I know concussions are not always due to a direct contact of the head or something like that. But do you think that works? Does that help to either learn how to be hit in a certain way that protects you, or to hit somebody in a way that is protecting the other person?
Mm-hmm. Yeah, there is a lot of research in like rugby, for example. Again, like tackling technique is really important, but in general, prevention is, the best cure for a lot of injuries. And so if we're not allowing athletes to put themselves in compromising situations, we're going to see a reduction in the number of injuries. So, you look at the NFL and all these rule changes that they keep making and how it's changing the game and all of this stuff. I think it has a lot of value because, again, there's not as many guys getting catastrophic injuries. There's not as many concussions that guys are out for, weeks of the season because, again, of all of these positive changes. And as that trickles down to the lower levels, it changes the game. But on the prevention side, as athletes are specializing in sports a little earlier than we may otherwise want, we're at least focusing on prevention, which is really important to, again, minimizing future risk of injury. Not only that, I think that it helps athletes develop better and be more well-rounded. So focusing on just core strength and, more movement patterns that are just valuable for not just whatever their individual sport is, but also just regular life.
Sure. That goes back just to dovetail a little bit. We talk about in PT a lot of times, again, going back to like just kids going into sports super early, especially like high level athletes, when their bodies are changing so drastically and they're only doing that sport 24/7 all the time, they may be more at risk for something like a stress fracture or, like you said, even just like a concussion, right? Like if you don't really have that core strength, right, to be able to hold the body up, that's a huge thing. I've seen actually, like I can 3 that I can think of off the top of my head, young baseball players that I had had stress fractures in their back, just from like the repetitive twisting of hitting the bat over and over again. And of course, the parents are asking why, like, why did this even happen, right? But it's always typically like the really lanky kid who went through a growth spurt in that past year that maybe just did not have the muscle mass or just the strength in their bones to be able to withstand those forces all the time, right? But I think that core strength and having that just generalized physique is so important, especially if they're going to be in that high level of a sport, doing that sport all of the time.
Mm-hmm.
That's very important.
Yeah, especially during those rapid growth phases of our lives.
Right.
Again, the the physics change of how we move, and strength
Sure.
is a constant battle, so to speak, of playing, catch up. And there hasn't been a lot of information for coaches to, utilize, or parents to utilize, other than in the last 5 to 10 years, when we have these more preventative programs that we are now in developing and utilizing on a regular basis. There's the FIFA 11, which is a nice like warm up, but also it's dynamic strength for soccer players. And then
Mm-hmm.
there's a FIFA 11 for older kids. There's a FIFA 11 for younger kids. And so, something like that, whether probably the most popular sport in the world, we can engage with the coaches to help reduce injury risk and also have a little bit of fun
Mm-hmm.
along the way. I think is really valuable for really young kids. But it's also why playing different sports is actually, I think, really important, because you think about the skills that, say, like an ice hockey player,
Mm-hmm.
needs the balance on skates to stop, the core control, the rotational control at speed to shoot a puck into a goal,
Mm-hmm.
the hand-eye coordination, knowing where your body is in space. It takes a different level of perception when you're on ice versus on a grass field,
Mm-hmm.
or a gymnast on a balance beam. And again, I think that there's a lot of underutilization of just body movement from different
Agreed.
regards. Whereas, hey, I want my kid to be a baseball pitcher. So what is he going to do? He's going to pitch all the time.
Right.
It creates a
I
lot
think you need that cross training.
of inconsistencies and patterns that, once they're ingrained, they're really difficult to break.
Sure. I mean, I just notice it in general, the kids that are doing some level of cross training, whether it's just other sports and other movements or just being on their own, working out, right? Doesn't need to be anything too special, but just doing some other type of training. I always feel that they seem to be the better athlete than the kid who's just pitching and pitching and pitching and
Mm-hmm.
pitching, and that's all they're doing all the time.
Mm-hmm.
Like they need to have that other level of strength to be able to get them to that next point, for sure.
There are very few athletes that are able to specialize early,
Mm-hmm.
and be able to be successful, compared to the athletes that generally do really well by specializing late.
Mm-hmm.
And if you look at a lot of other countries, their kids are having more fun and just participating in sports and not keeping score, and playing a different sport every season, and then getting a break, over the summer or at some point during the year, that allows their bodies to catch up to where they may have been otherwise, is again really valuable,
Right.
compared to, again, one kid playing one sport all of his life and then maybe fizzling out,
Yeah.
whether
Reduces
it's
the risk of
psychological or even if it is physical.
burnout for sure.
Absolutely.
So you're in a unique position being a young dad and being so close to and just having a great wealth of knowledge to concussion. But as your kids start to get into the ages of entering sports, are there any sports that you would restrict them from trying because of everything that you know about concussion? Or are you more under the impression of like you can try absolutely anything you want, but maybe you help train them in a way of being able to prevent them against concussion and just like that hard contact injuries?
I might steer them away from some certain sports, but at the end of the day, I want them to be happy, and I want them to participate with whatever makes them feel good and interests them the most. So again, I think the more variety I can expose them to, the better. As somebody that was running and doing a non-contact sport for a majority of my sporting career, I probably would say a non-contact sport might be the way to go.
Yeah.
But you think about, let's say, a sport like skiing or a sport like cycling, there is still a pretty high risk of injury or accident that can occur,
Absolutely.
on the slopes or on the road. And there are a lot of variables. So again, it's really difficult to really say, oh no, you can't cycle, or
Right.
oh no, you can't play football.
Anything
At
can
this
happen.
point. But again, I think that as a parent, again, they're evaluating that risk for those sports, and then what I let my children do. I might steer them away from, again, certain things, but at the end of the day, it's what they want to do.
I keep telling my husband golf. Let's get good. But you know what? You could be golfing on a golf course and get hit in the head with a ball. So you never know.
Absolutely.
You totally
You can
never know.
you can have rotational injuries as well.
Absolutely. I get it. Are you going to the PGA?
I don't think I have any time to go.
Shoot.
It would be really fun though.
Yeah. I live right near Newtown Square and it's been crazy, the traffic and everything, but it's going to be really cool. I'm excited. Oh, we're going on Sunday,
Oh, awesome.
which will be awesome.
Very
I know.
cool.
I'm very excited. So do you work with a lot of cyclists?
I actually have been working with a lot of just patients from a primary care perspective that like cycling.
Especially in this area?
Cycling is very big.
Yeah.
They're actually building a velodrome outside Westchester.
Really?
I think it's more Coatesville, but yeah, currently in development. At some point, it should be open soon. It's going to be a multi-sport facility, which is really great. But
Wow.
really exciting that the East Coast is getting another facility
Absolutely.
for cycling in the area. I'm hoping that brings back more cycling racing
Yeah.
in this area. It seems like it's been missing for years. I know the Philadelphia Cycling Classic has not been put on for a couple of years.
Hmm.
I hear it's coming back, which is pretty cool.
Yep. It's funny. After moving to Westchester from Collegeville, I've seen so many cyclists for patients, and it's kind of going back to what we were talking about with the little kids. It's the people who cycle and they only cycle
Mhm.
multiple days a week, but there's no other cross training involved. So they're really strong in certain muscles, but then other muscles there's basically no strength, and it's always so confusing to them because they're like, I don't get it. I go up hills, I'm going so fast, and I cycle for 50 miles, and how am I weak in these other areas? But again, it just goes into the next level of education too. So I was reading something about motorsport. Do you do anything in the motorsport world?
Not particularly,
Okay.
but I know it's an emerging field
Yeah.
in sports medicine, and
Yeah.
the physiological strain that a driver is under
I think
for
that's
a
so
couple hours
fascinating.
is quite taxing and can be stressful, physically as well as mentally.
Yeah.
And so there's a unique environment that they are exposed to that probably is undertreated
Yeah.
to some extent. And, a specialist that has experience, working with those types of athletes
Yeah.
has some value
Yeah.
for that population.
I think that's such an interesting because it really is a sport when you're going at that high of a speed. Again, going back to like the core control and the posture control. I mean, I can imagine that could be at a risk for injury
Yeah.
for sure.
Let me imagine we're exercising at 100-degree heat for, over an hour.
Right.
It's pretty challenging. And
Absolutely.
trying to stay hydrated and calories, to stay to the focus that is necessary for those millisecond adjustments that you need to make for the vehicle or braking or whatever.
Sure.
Formula One isn't just playing a video game.
Yeah.
It happens to be real life.
So true. So, talk to me a little bit more about some of the other modalities or other treatment approaches that you take. So, we talked a little bit about the osteopathic manipulative treatments. What about some like regenerative medicines? What do you do on that end?
Well, I think that those have a key component in injuries that have some actual physical disruption in the tissue or require more stimulation to heal. And so, again, manual manipulation, massage,
Mm-hmm.
a lot of the external techniques that we can utilize may not just be enough to generate that physiological response for healing. And that's where, there's some needling and physically direct treatments that are valuable for, again, generating that inflammatory response that will ultimately allow that tissue to heal. The athlete can then, or the individual can then, continue the recovery process,
Mm-hmm.
afterwards. Now, obviously, that's a spectrum of, some athletes just need surgery,
Mm-hmm.
but there's a lot of injuries that are mild to moderate and the tissue injury isn't as significant, so they don't necessarily need surgery and the recovery time that's involved. And we can treat that stuff, with a simple injection or a simple procedure in an office setting that
Mm-hmm.
allows that recovery process
Mm-hmm.
to flourish.
Okay.
And so, we talk about regenerative treatments like PRP or polotherapy or stem cell stuff. Again, it's just tapping into the body's ability to heal itself, which is, again, one of the core tenets of osteopathic medicine is really valuable, I think, for patients to heal better, heal faster, and have less missed time at work or missed time in their sport.
Mm-hmm. Do you utilize a lot of like cortisone injections or steroid injections, anything along those lines too?
I will, again, when it's appropriate, and
Certain cases.
oftentimes again it is maybe the first line,
Okay.
treatment. Maybe I help, well, to some degree, help me to diagnostically evaluate the patient and say, okay, what's the most likely area we're treating? But again, in certain situations, they're better suited going straight to a needle tenotomy procedure or
Mm-hmm.
even PRP
Okay.
right
Makes
out of the
sense.
gate.
Okay. So tell me a little bit more about Penta Health. Are you, what does your day to day look like? Are you able to get 30 minutes with a client, 10 minutes with a client? Are you able to get an hour? I mean, how does that typically work in this type of practice care
In
setting?
this setting, again, I try to give the patients as much time as they need. right now I get new patients, I can spend, 30 minutes with them, sometimes a little bit longer, obviously if it's necessary. As I get to know the patients, again, it may be a little bit more efficient over time.
Hmm.
But again, on a yearly basis, the preventative visit, I'd like to keep it around 20 to 30 minutes to address all of their concerns and multiple issues that necessarily need addressed. But
Absolutely.
when the majority of my time is spent talking about prevention, injury prevention, health prevention, that time is really valuable for the patient to get the information that they need.
For somebody that has an injury specifically, are you seeing them for follow-ups as well? I mean, is it every like 4 weeks, 6 weeks,
I think,
monthly?
again, that for the initial evaluation, and then is obviously, crucial to figure out, okay, well, what's the time frame going to look like for recovery?
Hmm.
But typically, I'm going to see somebody in follow up every 4 to 6 weeks, depending on what I'm doing, and then I'm hopeful that I can tail off those
Hmm.
follow ups as
Hmm.
necessary if the athlete is or the individual is doing better.
And do you guys have telemedicine options as well?
Yes, we do offer telemedicine as well as in person visits.
What drew you, because before this you were out in Lancaster?
Mhm.
Okay. What drew you to this area per se and also to Penn Health in general? What did you like about it compared to other practices that you were maybe considering?
Well, I liked the ability to be able to do a lot of preventative medicine and talk to patients about, again, their primary health, but also their athletic pursuits and their musculoskeletal injuries. Again, that's where I have a lot of my experience. But being able to treat the entire individual and integrate musculoskeletal care into patients' primary health
Hmm.
is really important.
Hmm.
And again, it gives me a lot more control over what and how I can treat individuals as well as
Hmm.
screen them for just general health conditions that otherwise could be missed.
Okay. And as you build this like musculoskeletal care practice for somebody who may not be in the clinical world, what is the goal of that? Or what do you mean by musculoskeletal care?
Um, when I
A
say
brief
that, I mean
version.
again, for that cyclist or for that swimmer or that runner, I want to keep them moving and I want to keep them happy and I want to be able to allow them to pursue their goals. Obviously, I'm not going to be a barrier to that, their pursuits, but I want to make sure that I optimize it as much as possible and then translate that into how does that fit into their regular life.
Hmm.
Whether a parent, whether they're a professional in their line of work, health and your athletic pursuits aren't just related to the time that you spend training. It's all those small decisions we make on a regular basis.
Sure.
What we're going to eat for breakfast, how much sleep we get, how much time do I spend in front of a screen. Where am I reducing my stress? Where am I getting my stress? What types of foods am I eating? If I'm eating supplements, where am I getting them from? There's a lot of small things that we don't necessarily realize. We're making those small decisions every day, and they can have a
Absolutely.
big effect on
It
over
adds
time.
up so fast, so fast. Well, this has been fabulous. Thank you so much, Dr. Eck, for coming in today. And just for people to know where you're located, can you just give them a little intel in terms of where to find you?
I'm practicing at Penta Health Practice in Downingtown, Pennsylvania. It's right on Wallace Avenue. I'm not the only provider that's now accepting patients, but we have a great team of physicians that are accepting new patients. And you can find us at pentahealth.com.
Well, thank you so much. This has been so fun. Keep learning, keep moving, and we'll see you next time.